Our next speaker for today is probably the most experienced person in the room coming to psychedelics right now, and this is Dr. Ose Hein. She's a psychiatrist in her own private practice in Solothurn and has over 30 years of experience focusing specifically on classical homeopathy. She's also an experienced Zen meditator with Vanya Palmers and has trained in alchemical circle rituals with Rolf Metzner. Her most important contribution, though, for today's topic is, of course, her being a member of the SÄPT, which is the Swiss Medical Society for Psychedelic Therapy, where she's not only a psychedelic therapist, but also an accompanying study physician within the phase 2 study of treating severely ill patients with LSD.
For the nice introduction. Thank you, Federico, for inviting me to speak on the subject of the accompanying research we plan to do alongside with the treatment of patients in psychedelic therapy in the framework of the special permissions given by the BAG. So, what the SÄPT does and has done is it is the Professional Society for Psychedelic Therapy in Switzerland, and it's fostering many things: research, therapy, training, networking, and cooperation among the medical colleagues who are interested in this field. And under the guidance of Peter Gasser and Matthias Lichty from Basel, there have been conducted 2 studies on the effects of LSD in patients with severe diseases and anxiety disorders. And one of that, the second study just finished this year, and we hope that the results will be published along in the course of this year, hopefully. And the SÄPT is working in cooperation with the BAG and the University of Basel and with Matthias Lichty, and currently inserting this accompanying research. So what I would like to do, because we have not collected data yet of the research we plan to do, I tried to find out what might be interesting for you alongside with the structure of the research we do and we plan to do in this and accompanying the patients related to that. And so I decided to present a case which I have been treated in the study of in the second LSD study, and then link it together with the structure of the research we plan to do. So when we start, I would like to start with the patient's experience, what I just said, and it's a male participant of the recently finished study, and he was diagnosed with Parkinson's disease, and he had panic attacks, anxiety, depressive episodes, and the diagnosis of the Parkinson's disease was confirmed by the MRI and by the dopamine release measurement. He was on Madopar in a low dose, not too much. He just needed the 62.5 milligram Madopar 3 times a day. So, because of the fears, he had been in talk therapy since 2016, and the fears existed already since early childhood, such as claustrophobia and sudden loss of contact and the like, and as well as fear of the fatal course of his Parkinson's disease, of course, which worsened then in his depressive states. And his physical symptoms developed since 2017. In addition to the trembling of the hands, he had slowed gait, the typical features of a Parkinson patient. A tendency to fall and a delay in starting to move. And he had numbness of the feet. That was the condition he came when he entered the study. He is an academic with an intellectually and socially demanding profession. He's a lawyer. He had a conservatively and rigid upbringing, and he was controlled in his emotional expression and disciplined and dutiful. And he was saying he was meditating since 20 years, and he described it as follows, that he said that was his intention, and that was how he was trained. It is also about perceiving the moment there and leaving behind the imprints to practice self-awareness and simple being. This is, it seems like that the meditation training gives a bit of a capacity to stand difficult situations in treatment with psychedelics. So if you have someone, or if you yourself are mentally trained, it is of a benefit to stand difficult times during this experience. So, and then in the course of the first session with 200 micrograms LSD, which usually lasts about 12 hours, and he wrote afterwards, and the next day he gave he collected the notes and his thoughts and the notes, and he said, or he wrote, he couldn't remember anything of the first 5 hours. He was blank. It was not possible for him to remember anything, or not much. I perceived again and again the feeling that it gets tighter and tighter towards the top. I can't breathe. I feel nauseous. Everything constricts towards the top. You really felt constricted. Fear comes up that manifests itself first and foremost in my thoughts, but is deeply connected to the physical perception. Will I get out of this again? So he remembered the fear. That was all he could remember. Will I get out of this again? Will this ever stop again? Will calm return? Can I still breathe? Will my heart burst? Can I still move? And is there anything that gives me a firm grip on something? So the external seemingly normal, that's what he was thinking then later on in the night, or when he wrote it down. The external seemingly normal, which is constantly in motion, but which I now perceive only as completely shifted, deconstructed. Nothing gives hold, and abundantly clear, the inner world, which I can break down into thoughts and feelings and other perceptions, without that which otherwise ensures control, or the impression of control still being present. It all gets completely out of control. That was the state he was in. And from the outside, when I accompanied him, we started at about 9:30 with the remedy, or with the substance, and until 2:30, 3 o'clock, he was laying down, suddenly starting up. I spoke a few words so I could get in contact for a moment, and then he went back on the mat. That was how he described his first session, part of the session. And so this is important to collect in the scientific research. The targets which we aim to collect is the acquisition of acute effects, which would be, in his case, strong fear, dissociation, and panic. The course description, of course, of the whole subjective effects, the documentation of frequent adverse effects, but this is, of course, a summary of many cases which we haven't collected so far, and the flashbacks, persistent changes in cognition, sleep disturbances, and effect on addictive behavior. because we have several, not only depression, people with depression as well with alcohol addiction, with different forms of very severe states. And then, so at this point of his experience, he struggled for hours with the so-called ego dissolution. This is in fact what was the problem where he was stuck. And to explain this, I just go into this a bit, the importance of that as well. There's always a point, the eye of a needle is to get into the ego dissolution and not to, and somehow the organism, we don't know why, sometimes decide to pass easily and sometimes to stand behind for hours. And that is a really difficult time because you have to somehow stay alert, or if you can, stay alert and observe what's coming up. But if it's fear and anxiety, it's really difficult to hold inside. And for this reason, it's often experienced as fearful. And as a therapist, you have to deal with the situation somehow. And it can be silently experienced in the patient, or it can be expressed as shouting or whatever. And somehow you have to accompany the patient in this situation. But first you have to know that this is the threshold of ego dissolution, which is the problem. And this is an integral part of the substance experience, and it is an essential aspect of being able to enter into the deep mystical experience that seems to correlate with the depth of the healing. And this seems to come up in the studies when you read the recent or the studies of the last years. You find that the mystical experience and the depth of the mystical experience has some correlation with the depth of the healing. And you must pass the eye of the needle, the ego dissolution, otherwise you can't enter the space. It's not possible to have, otherwise you stand before the door. And as a caregiver, you have to know about this point. And then you can do something, and it's a relief if you know that consciously for both sides. And then you have to know, or it's clear that usually when you have a psychiatric patient who has a psychosis or schizophrenia, that it's all about the ego dissolution, and that's the reason why for this time, at least as far as we are able to accompany patients with this, that psychotic patients and schizophrenia is a contraindication to do this treatment. It is related to the ego dissolution, which usually for schizophrenia and psychosis is the problem. So in the contrary, the succeeded ego dissolution is accompanied by this so-called oceanic boundlessness, and this is an aspect of the mystical experience. So the dissociation is the important point in the first part. Usually it's in the first part of the experience, and we developed the question together with the BAG, the questionnaire, one questionnaire before the treatment starts, and then a questionnaire directly after the experience, after each experience of a substance. And so this is filled in afterwards, and to collect as well the mystical experiences and the recording of the adverse effects are then retrieved. And in his case, the adverse effects, of course, would have been the almost complete dissociation. And you can recognize that it's a dissociation because you can recognize it because the patient doesn't remember properly. A substance experience with LSD, with MDMA, or with psilocybin, usually you can remember and recollect when you're present, and when there is the dissolution of and the disconnection, then the memory is not clear, and that's the point where you can know, oh, it's a dissolution. No, not a dissolution. It's a dissociation. So he had no mystical experience so far, and then I tried to. When the patient is not speaking, it's not so easy to find out if it's a dissociation or if it's just a silent flow. So after some time, he is not really there, because sometimes you try to contact the person and see if the contact is vivid, if he's present. And so I knew after a while that he is in a dissociative state, and as it took so long, it was unusually long to have it in 5 hours in this state, and I was concerned how he could come out of it. Again, it was already long after the peak of the experience. And then I thought maybe I can do something with the music. And I purposely played ALPS, Alina. I don't know if you know that. This is a very structured, bit like, in this very soft, fine manner, a repetition of fine, soft music, but really in a structured way. And he reacted to that incredibly. So the turning point then in the first session was about after 5 hours, and he reports then he wrote it that way. It was already in the middle of the afternoon and the sun was shining, and when, according to my memory, I could really let myself fall for the first time, to the heartbreaking, beautiful music of ALPS. That's when tenderness, love, and warmth rose up in me. So he could just use the music to shift his perception. It was just like that. He was completely changed after that. It was a turning point completely, and it took hold of me in all my cells. And in principle, he finished the session in this state then. So I could release him at home for the night and saw him next morning, of course. And I asked him to, if possible, to write a protocol. And he said, he wrote then, he was very moved. And then all the night he had the same, it was another profound experience with himself. He saw situations, and the difference was that he could experience it, and in the same time, he could observe it. And this was the help he could instill now. That he could manage, and he exercised it the whole night. He was always having situation, observing, feeling it, observing it, and then doing some kind of process in this experience. And he said, it is as if he had a little light within himself, and keeps guarding at himself. So he could see the light at the end of the tunnel, and he felt protected. And it had led him to these states again and again. And whenever he laid down, it started again, but he could manage. And he said, I arrived at myself. And he no longer had the feeling of losing himself. He had managed not to walk away from this feeling. He had perceived it, and he had also made him afraid, but he was able to deal with it differently. And he just got into it. So his mystical experience and losing the sense of time and space and just being in that process was right after, was a long time after giving the LSD. It came during the night. He had a totally different time schedule than it was set by us. And So the realizing that the dissociation is a possible resulting and usually temporary condition when the I dissolution is stuck and the fear and confusion stay instead, this leads to the understanding, what I already said, that we currently at least cannot treat this properly. It might be different in the future, but for the moment being, to deal with this in a psychiatric patient with psychosis or schizophrenia, you have to really, really be trained in that. So even and as well when family, a close family is having such a condition. The characteristics is when you don't remember, when you have a separation from the conscious of the feelings. And in such a case, they cannot be remembered. And according to Ralph Metzner, what is the transcendence part and what is the dissociative part? And Ralph Metzner, who was one of the pioneers of doing the studies at the time of Timothy Leary and so on, they all went and worked together at that time. He said, it could be the idea to differentiate it. It could be the idea that transcendence is a conscious dissociation, while dissociation is an unconscious transcendence. And this fits quite well for that. So the turning point in the first session I have already told you, and the first, the day after the session, I summarized as well. So the measured characteristics of a mystical experience, which in his case would have arrived at the day after only or in the night, would be measured in our research with as well with the 5D ASC questionnaire, and investigating the inner unity experience, which means the merging with the ultimate reality, the outer unity experience, which means the merging with all things, everything is one, and the transcendence of space and time, the sensation of the sacred, and the noetic quality. This is the assertion of the intuitive knowledge of an ultimate reality, and the deeply felt positive moods such as joy, peace, and love, which he had during the night. At the end of the night, he said, I completely felt at peace. I just arrived at myself and all was fine. And this was not sure after the first 5 hours where he would land up. So the follow-ups which have been part of the study were taken 2 months after the session, and he said, I'm really feeling humility and gratitude. It feels as if this experience adds an essential element to all that I have experienced and accomplished in the years before in context of my various therapeutics approaches. And what he meant was the direct, immediate experience and at the same time the observing of this experience. This is the crucial experience has been the crucial experience for him to gather results which last. And the deeper I arrive at and within myself, the more I do that, the more I do this procedure, the more I arrive at myself. And 5 months later, he said the physical symptoms are getting better. The Parkinson's, he didn't change any of the medication. It was still 62.5 3 times a day of Madopar. And still the symptoms after 5 months started to become better. And the numbness of the tooth was much better. His movements were smoother. And 6 months later, he said he is now permanently well, no longer anxiety or depression. The numbness is completely gone. And this constructive element, he said, that he creates his own reality himself. He became aware in the session that it's your point of perspective, and this leads to your reality you perceive. It comes from what I focus my attention on. When I focus my attention on fear, fear comes. It's that simple, and he could get it, and he was sure about, and this set him free to do different. And the final study interview after 1 year was that was the question what effect had the LSD on the Parkinson's disease, and the movement were much more rounded. The autoaggressive component, it was interesting that he mentioned that, which he had already since childhood, an autoaggressive component. He said, I chewed and chewed and chewed on this during the time afterwards, and now it had turned. It turned around. He was himself surprised about this, and he had not changed anything still, no medication changed. So it was really the ongoing process he went into, and it was, for me, it was a complete surprise what he made out of it. It was really fine, really a gift. And then he wrote the last mail 3.5 years after he had 2 sessions of LSD, that was all. He was 2 sessions of LSD and 2 placebo sessions. And in the time that followed, he said, I no longer experience myself as being gripped by anxiety. I have become more courageous and self-confident, also more relaxed, and I definitely related to the experience. And my former fears have all but disappeared from my life. My physical conditions have also improved enormously, so much that the neurologist said he was doubting the diagnosis, but he said the loss of dopaminergic cells is no doubt on, but he said I can manage my life much better, and it's stable, and that's fine. It's not progressing. He had a better relationship with his partner, and can perceive and place his interests and his wishes. So the key factors for the good progress and we all have to collect, or it's good to collect these features, and we do in the accompanying study and in the accompanying research. It's not a research which you do at the university, but it's collecting the data which we need to justify and to prove that what we do in the practice is reliable and it's safe. And the turning point was letting go of the dominance of the ego. It's not the ego is disappearing. It disappears in the perception for a while, but it comes back later usually. But the dominance, to let it go. And he had experienced it before as a prison. And he said he could change a no to life into a yes, which is just comes alive again. And the auto-aggressive component, this was a key factor for the good project progress. And the very moment where he vividly described it, the both time and ego dissolved, was the experience of a deepening of the mystical experience, which in turn deepened the healing. So in his case, I could, after when I worked it out, I could understand the importance of the mystical experience, the depth of the mystical experience. I'm sure by now that the deeper this may appear, that the more healing may be the result. I don't know if it's in any case, because I haven't seen it to name it in hundreds of patients, of course. But the experience in him was that he really went into that, and that he had really a bad time, and he could make the best out of it afterwards. And it's a before and an after, and it's a life before and it's a life after in his case. And so, and as well, to recognize and letting go of the constructions of his worldview was a healing factor as well. And that he could allow more and more that what happens, happens, and not making anything up of that. And he was able to significantly improve the relationship and can stand up for his needs, and he has thus been able to take significant steps towards the fundamental improvement of his complaints. It's all together, and when we do this research on the practical side, I'm sure we can find out which are the features as well from that side which supports this process, and which are the dangers and so on, which you from the university try to find out from the scientific approach from that side. So why is this important? It serves, of course, the quality control of the psychedelic-assisted therapy. We need to have a kind of control and install it ourselves. And it's a need to prove what we do, of course, and that it's effective, secure, and helpful through researching it on it. And it documents as well the acute effects, eventually as well the long terms. And the long terms we have not yet scheduled, but probably it will add afterwards. In his case, the results came up after 1 year. Our schedule so far is that we investigate before the treatment, then immediately after the experience, and then 1 month after the finishing of the treatment. And it would probably be a good idea to investigate again 1 year afterwards, at least. And it allows further investigation of the importance of the mystical experience, of course, and its value. And it mirrors the side effect and the risk, of course, as well. So if he somebody who, what is it that makes him stay in a dissociated state, for example, and when does he come out, and all these things would be. I have had a patient now, a deeply traumatized patient, which I accompanied with MDMA, and I never have seen it before, and others have been very surprised as well, that she was dissociated from the very first half hour. She was dissociated, and she had a retrograde amnesia afterwards. Even she didn't know anymore how she came. She didn't know anymore that she had made arrangements with her son to be taken overnight at his place. And it was but it was still, how do you judge this on then? And in my impression was that before she was in complete control on all in her life. And I accompany her as a patient already since 1.5 or 2 years, and we have a trusted base, a trusted, really good base. And so she allowed herself to let go. This meant she dissociated completely. But it was the first step to be able to maybe approach slowly to that what would be necessary to be confronted with, maybe. It was so she couldn't even remember afterwards, and still some things came back, but it was all the time she was off, just off. She was well afterwards, that was fine, but to know, and that this could happen with MDMA, I couldn't believe it. I thought it was heart-opening and may give her some space to, but it was just dissociation. So the timeline, which I said already, of the investigation we do now with all the patients, is the first questionnaire before this first session, the questionnaire 2 at the end of each experience, and no matter if it's LSD, MDMA, or psilocybin, which we do, these 3 we are doing for the moment being, and the planned or the not yet scheduled questionnaire after 1 year, at 1 month afterwards, and the 4th after 1 year, not yet scheduled. And the content of the questionnaire of the questionnaire 1 would be its abbreviation is SMILE, the schedule for meaning and a life evaluation, where you are asked how is your subjective situation in your life and the stages of recovery. This is the second questionnaire, including 30 items, and they record the stages of the psychology recovery. So where he is for the moment, if he is in a state of absence of hope, or if he assumes the possibility of recovery, or if the foundations of the recovery are already laid, or setting and achieving meaningful goals, and if he already feels that he has psychologically recovered from and overcome from the illness. So to measure or to collect where he starts from. And the questionnaire 2 at the end of every session would use the 5D AHC, the 5 dimensions of altered stage of consciousness scale with 94 items for the acquisition of the acute subjective effects and including the mystical experience and the recording of the adverse effects. The recorded adverse effects are similar as was Professor Hasler presented already, and not that differentiated. Yours is much more specific. But for I don't know if we will do it. It's a good suggestion. Maybe we should open it for wider investigation. I don't know. We'll come tell Peter about, maybe it's a good idea. I don't know. This is not in my hands. So the questionnaire 3 is 1 month after the last experience, and again we use the smile and the story questionnaire, and then in addition the persisting effects, about 140 items, so they have to fill in lots of pages, and this questionnaire records the persistence effects attributed to this substance in the attitudes, the mood, behavior, and the social aspects, and is valuing the personal and spiritual significance of the substance experience as a change in personal well-being through substance experience. And this would be, of course, a matter of question after 1 year as well, if there is any difference, if it's reducing after 1 year, for example. And as well questions concerning flashbacks, persistence, perceptual changes, sleeping disturbances, and addiction issues, problematic substance use, and there's space for own comments as well. So, yeah, this is the concept of the 12 months questionnaire, and where we would collect the positive and the negative effects to see what is the result in the long term of what we are doing. And if somebody is interested in the questionnaires, they can be obtained from the SÄPT website. And at the end, I would like to mention that we do another psychedelic-assisted therapy Tagung meeting, and this will be this year on Thursday 24th and November 22 in Bern. And with this conference, we would like to reach out and invite especially those colleagues who are already working within the framework of the licenses granted by the BAJ, or those who have a great interest in that. And as well, the colleagues who are interested in further training, collegial exchange and networking. So that's my finish, and thank you very much for your attention.
Thank you. Thank you very much, Ose. We don't have that much time for questions, maybe 1 or 2.
You mentioned the rigid upbringing and
Yes.
conservative nature, and of course, many neurologists have this idea that there's such a thing as a pre-Parkinsonian personality type marked by such rigidity.
Yes, it is obvious that it could be linked, yes.
Yes, so it's not really a question, but just a speculation, I suppose, that this individual's particular response might be somehow tied up with their a mysterious association between their personality and their
yes, I would say so.
disease.
Otherwise, it could not have been such a result. It must have been linked somehow, because he had made such for all of us an astonishing progress and astonishing cure, almost cure, not really, but such an amelioration that and he describes basically that he altered in his way of dealing with fixed concepts before. So he said, I felt myself being in prison. I was imprisoned inside myself, and I could find the exit through experiencing and not running away, but standing and observing, and then get other conclusions. Yes, it is. I would say it is related as well.
Okay, one last question.
Yeah, I was wondering if you are familiar with autistic catatonia and if this might be related to
Sorry, can you speak a bit louder, please?
Yeah, sure. Sorry.
Thank you.
I was wondering if autistic catatonia is related to Parkinson's disease, as they seem a bit similar, and that a state of stress might actually induce this extreme state of dissociation, and if LSD or this kind of therapy could work for autistic catatonia as well.
Autistic catatonia?
Yeah.
I have no experience with that, I'm afraid. For autistic conditions, autistic conditions, they can do this therapy as well, but I don't know if it would alter the autistic, but they can manage through and find for themselves be able to enter a mystical experience for sure as well. What this does in an autistic condition, I don't know, but what I'm sure of is that they can enter in the same procedure and enter in the same experience and get their results, which are according to their condition, which they can get and highly benefit from that. If it's in catatonia, I have no idea. Sorry.
Okay, thank you very much, Ose.
Thank you.